Hi, I'm Dr. R. Sureshkumar. I'm the lead neurologist in Vinay Medicine Hospital. And today, what I'm going to discuss is what should a person with epilepsy do if he or she is unable to tolerate the pain. Now, we all know that the best way of treating epilepsy is by giving anti-seizure medication. But these anti-seizure medications have got certain ingredients which are basically chemical compounds, and they can have reactions on the human body. So, though many of them tolerate anti-seizure medications very well, but there are people who develop allergic reactions or are unable to tolerate these medications. So, I'm just going to tell you what should you do if you are not able to tolerate anti-seizure medication. The first thing you should always remember is never stop the drug on your own. You should always go back to the doctor who had prescribed that medication, and then he will do what is required for you. Never stop the medicine and go to the doctor, because sometimes what happens is that the time you stop the medication and then you go after a week to the doctor, you may throw up another seizure at that interval period of time. And sometimes it may be very uncontrollable seizures like status epilepticus, and you may end up in an ICU. So always see that you immediately inform your doctor the moment you are facing some problem with your antics. So never stop it on your own. The second thing is that you should all know that why people develop intolerance to anti-seizure medication. So one thing is possibly the dose which has been started for you may be on a little higher side for your body. The anti-seizure medication dose are usually calculated by the kilogram body weight of the person. So if a person having 70 kilogram body weight, the dose will be markedly different from somebody who has a weight of say about 30 kilogram. So based on this, the dose can vary. So the tolerance to this dosage can also vary from person to person. So what you should immediately the doctor can do is that the doctor can reduce the dose of the medicine for you and see if you tolerate that medicine. Another thing what we can do is that the dose sometimes can be reduced and given more frequently. Like some drugs can be given even 3 times a day. If you're giving a higher dose 2 times a day, then you can slowly break it up and then give it 3 times a day, so that the total dose going at one point of time is less. So that's another thing you can do. The doctor can also change the anti-seizure medicine, because some people do not tolerate a particular kind of, and then another molecule will work better on it. So the seizure drug may be changed by the doctor if he feels or she feels that this drug is not working for you. Sometimes you can just change things, like the doctor may ask you to take a medication after food. There are certain drugs which cause a lot of gastric irritation. So just by taking this medicine after the food, you can reduce the gastric irritation and as such reduce the intolerance. Then there are certain side effects which are very serious, and it's like we call it the Steven Johnson syndrome. So certain drugs can cause severe, rashes and ulcers in your skin and body and in your mucosal areas, eyes, throat, mouth, etc. So this is a very dangerous situation. At the moment some doctor starts you on an anti-epileptic or anti-seizure medicine, and you find that after a couple of days you are developing these kind of rashes or ulcers in your mouth, immediately go to the doctor. In that case, even you can stop the medicine and go immediately to the doctor without wasting it. So sometimes what the doctors do is that it is a sudden increase in the level of the drug in your blood which is causing the problem and the side effect. So the doctor, what he may or she may do is that he may give you an extended release form of the same tablet, so that there is no peak level of the drug suddenly in your blood, and the level is almost throughout maintained at the same level. So this is called the extended release medication. Then there are other ways also of managing this, like for example, for tried with multiple medication. Like you have a refractory seizure, you are already on two or three medications, and these medications are intolerable. Then there are other non-medical ways of managing, like the doctor can send you to an epilepsy center to see if a surgery can be done and reduce the seizure load, and the dose of the medication also can be reduced. There are certain neuro stimulation methods like DBS, deep brain stimulation, vagal nerve stimulation. This also may be recommended by a doctor. These are not done by every hospital. They're only done by very specialized center which has got the capacity and the know-how and expertise to do these procedures. So the doctor may send you to such a higher center. Sometimes modifications of drug, like taking a high-fat meal like ketogenic diet, can also reduce the seizure. So it is called a ketogenic diet. So these are some of the ways by which, without adding more medication, the doctor can get control over your seizure. So to end everything, I would say that you can always develop intolerance to medications, especially anti-seizure medication. The moment you realize that you are having some problem with the drug, do not stop, I said, immediately and wait or say do anything. Just immediately call up the doctor, the hospital, or go to their outpatient the next day. Tell what is your problem, and the doctor will surely help. Thank you so much.